Government says it is losing 300 million kwacha a year to treat health complications of unsafe abortions, which are on the increase in the country. Speaking during the preliminary National Consultative Workshop on the review of laws on abortion, the Ministry of Health says there is need to come up with a clear framework that clearly addresses issues of abortion. As Peter Macau reports, stakeholders say restrictive laws are contributing to the increase in unsafe abortions, which are fourth commonest cause of maternal deaths in Malawi.
The need to review laws on abortion in Malawi comes following concerns that current regulation is putting women's lives at risk. While abortion in the country is legal in certain circumstances, records indicate complications of abortions are the fourth cause of maternal death in the country. Participants here observe that abortion is a public health problem in that the cost of medical care continues to rise. Principal Secretary in the Ministry of Health says there is need to come up with legislation that iron out issues about abortion as it is a complex issue. Mwansambo observes complications from unsafe abortion are draining a lot of resources from the ministry's annual budgets.
As a country, we've been spending significantly on managing the complications of unsafe abortion. We've been spending roughly about 300 million a year managing this, and in the studies done locally, about 31,000 women annually are affected by either complications arising from these unsafe abortions. So it's high time that as a country we brought all the stakeholders together to discuss this issue once for all.
It is also reported that 60% of the gynecology beds in Malawi are filled up with patients with abortion-related cases. One of the participants here, Jesse Kabwira Kapasula, calls for measures that would make abortion safer, saying it is only the poor who are largely affected.
This is an issue that's killing women. And as a result, it is very rich for people to stand on the podium and say, well, let's see if, do we really need to do this? Well, women's lives are being lost. And the unfortunate part of it is that majority of the poor in this country are women. And the young girls that we are also losing here, we need to ask ourselves as a society that, are we not sacrificing people who get pregnant and leaving the impregnators going scot-free? So what we need to think about here is, let us make sure that abortion is accessible to those who need to have it.
However, some religious leaders question the whole idea of allowing a woman to terminate a pregnancy. To them, safe or unsafe, abortion is killing.
Is that unborn fetus a human being with right to life or not? That's all I want to say first. And in my opinion, yes, the unborn fetus has a right to life, Section 16. So therefore, abortion is not safe, at least for the baby. We know 100% that it's not safe for the baby because the baby will die in the process.
Meanwhile, this meeting has observed that there appears to be no international instruments that give human rights to a fetus. But the church's position is that life begins at conception and terminating it is as good as killing a human being.